Top 3 vitamins every diabetic must take. Lower blood sugar. Hey there. If you're managing diabetes, you've probably heard the usual advice: cut back on sugar, take your meds, and keep an eye on your carbs. But here's something doctors don't always talk about: nutrients, specifically vitamins that can make a massive difference in how you feel and how well you control your blood sugar. Without the right vitamins, your insulin doesn't work as efficiently, your nerves can weaken, and complications like neuropathy or heart issues can creep up faster than you'd expect. Here's the kicker: most diabetics are low on these key vitamins and don't even know it. Ever feel exhausted no matter how much you rest? Struggle with tingling in your hands or feet, or find it tough to keep your blood sugar stable despite doing everything right? Chances are your body's missing something critical. Today, we're diving into the top 3 vitamins every diabetic should prioritize, why they matter, and how to get enough of them every day. Before we start, a quick favor: if this video helps you, please hit that subscribe button and give us a thumbs up to support our work. Let's get into it. Number 1. Vitamin B6. Let's kick things off with vitamin B6, a nutrient that doesn't get nearly enough attention, but is a game changer for diabetics. Why? Because high blood sugar messes with your B6 levels in a big way. When your blood sugar's elevated, your kidneys flush out excess glucose, and unfortunately, they take a lot of B6 with it. Add to that the fact that diabetes comes with inflammation and oxidative stress, which burn through B6 as your body tries to repair itself. On top of that, some common medications like metformin for diabetes or certain blood pressure drugs deplete B6 even further. High insulin levels can also interfere with how your cells use B6, making it harder for your body to keep up. The result: many diabetics end up deficient without realizing it. So how do you know if you're low on B6? The symptoms aren't always obvious, which makes it tricky. You might feel unusually tired, like you're dragging through the day. Brain fog, mood swings, or even anxiety could be signs, since B6 helps produce neurotransmitters like serotonin and dopamine. One of the biggest red flags is nerve problems, tingling, burning, or numbness in your hands and feet. That's because B6 is critical for nerve repair and function. Other signs include muscle weakness, poor coordination, dry or flaky skin, frequent mouth sores, or a weaker immune system. In severe cases, low B6 can lead to anemia, leaving you dizzy, pale, and short of breath. For men, low B6 can reduce testosterone and sperm quality, affecting fertility. For women, it can cause irregular cycles or worsen PMS symptoms. It even impacts libido, since B6 supports mood and energy. Why is B6 so important for diabetics? Let's break it down. First, it's essential for glucose metabolism. B6 helps break down glycogen, the stored form of glucose, so your body releases energy, steadily preventing blood sugar spikes and crashes. Without enough B6, insulin resistance can worsen, making it harder to manage diabetes. B6 also protects your nervous system. It repairs and shields nerve cells, which is crucial for preventing or easing neuropathy, a common diabetes complication. Your kidneys rely on B6 to fight inflammation, and low levels increase the risk of kidney damage. For your eyes, B6 supports the tiny blood vessels in the retina, helping slow the progression of diabetic retinopathy. And let's not forget your heart. B6 lowers homocysteine, an amino acid that damages arteries and raises the risk of heart attacks, strokes, and high blood pressure. Without enough B6, your blood vessels stiffen, making circulation issues worse. So how do you get enough B6? Food is the best place to start. Chickpeas are a superstar. 1 cup of cooked chickpeas gives you about 55% of your daily B6 needs. Beef liver is another powerhouse, packing around 50% per 100-gram serving. Wild-caught salmon delivers about 40% per 100 grams, and it's loaded with omega-3s for heart health. Turkey provides around 40% per 100 grams, and sunflower seeds offer about 30% per ounce. If you're into gourmet meals, try a Japanese-style miso-glazed salmon with a chickpea puree. 180 grams of salmon and half a cup of chickpeas will give you over 90% of your daily B6 plus healthy fats. Or go for a French-inspired beef liver pate with roasted garlic potatoes. 100 grams of liver and one medium potato covers about 85% of your B6 needs, while boosting energy with iron and B12. A Mediterranean chickpea and lamb stew with saffron. 200 grams of lamb and 1 cup of chickpeas delivers about 80% of your daily B6, along with muscle-repairing amino acids. If food alone isn't cutting it, supplements can help. Look for bioavailable forms like pyridoxal 5-phosphate or P5P, which your body can use right away. Thorne Research P5P at 33 milligrams per capsule is a great option for nerve support. Pure encapsulations, vitamin B6 at 50 milligrams per capsule is another solid choice. Most diabetics do well with 25 to 50 milligrams per day, but check with your doctor before taking higher doses, as too much B6 can cause side effects. Some habits can make B6 deficiency worse. Refined grains like white bread or pasta lose most of their B6 during processing, so stick to whole grains. High sugar diets burn through B6 faster as insulin spikes increase demand. Alcohol messes with B6 absorption and breakdown in the liver, and medications like birth control or metformin can deplete it over time. Vitamin B6 is a must for diabetics. It helps insulin work better, protects your nerves, supports heart health, and keeps your energy steady. If you're dealing with fatigue, nerve pain, or unstable blood sugar, B6 could be the missing piece. Number 2, vitamin E. Next up is vitamin E, a fat-soluble antioxidant that acts like a bodyguard for your cells. For diabetics, it's critical because high blood sugar creates oxidative stress. Think of it as rust that damages your nerves, blood vessels, and organs. Your body uses up vitamin E faster to neutralize this stress. And since diabetes can impair fat metabolism, it's harder to maintain healthy levels. Low vitamin E doesn't always scream deficiency with obvious symptoms, but there are signs to watch for. Muscle weakness or trouble with coordination could mean your nerves and muscles aren't communicating well. Numbness, tingling, or worsening neuropathy symptoms are big clues, as vitamin E is vital for nerve health. Dry, irritated skin or slow-healing wounds might point to low levels. Vision issues like trouble seeing at night or eye strain can also signal damage to the retinal blood vessels. And if you're getting sick more often, your immune system might need a vitamin E boost. Why does vitamin E matter for diabetics? It's a powerhouse for preventing complications. It protects cell membranes, keeping your nerves, muscles, and blood vessels strong. By reducing inflammation, it improves insulin sensitivity, helping glucose enter cells more effectively. It also regenerates other antioxidants like vitamin C, strengthening your body's defense system. For your heart, vitamin E keeps arteries flexible, reduces inflammation, and prevents cholesterol from oxidizing, lowering the risk of heart disease. It's crucial for nerve function, shielding nerve cells from damage and easing neuropathy pain. Your kidneys benefit too, as vitamin E fights oxidative stress that speeds up kidney disease. For eye health, it protects retinal blood vessels, slowing diabetic retinopathy. Vitamin E also supports fertility. In men, it improves sperm quality, and in women, it balances hormones for ovulation. Poor libido. Vitamin E boosts circulation, which is key for sexual function. Without enough, your body's cells become inflamed, age faster, and are more prone to diabetes complications. Where to get vitamin E? Sunflower seeds are a top source. Just 1 ounce gives you about 66% of your daily needs. Almonds pack around 48% per ounce, and hazelnuts offer about 28%. Cooked spinach delivers 20% per cup, and avocados provide around 15% per medium fruit, plus healthy fats for absorption. For a gourmet touch, try a Mediterranean grilled sea bass with an almond herb crust, 120 grams of fish, and a quarter cup of almonds give you over 70% of your daily vitamin E. A Japanese roasted duck breast with a hazelnut miso glaze, 180 grams of duck and 25 grams of hazelnuts delivers about 65%. Or whip up a French avocado and sunflower seed tartare with truffle oil, 120 grams of avocado, and 2 tablespoons of seeds for about 60% of your daily needs. Supplements can help if food falls short. Choose natural vitamin E like D-alpha, tocopherol. Synthetic versions aren't as effective. Pure encapsulations, vitamin E at 400 IU per soft gel is a great option. Now, Foods Vitamin E, also at 400 IU, includes a mix of tocopherols for broad antioxidant support. Stick to 200 to 400 IU per day, as too much can thin blood. Check with your doctor first. Some habits worsen vitamin E deficiency. Processed vegetable oils like soybean or corn oil increase oxidative stress, depleting vitamin E. High-carb, sugary diets fuel inflammation, burning through it faster. Alcohol damages the liver, reducing vitamin E storage, and low-fat diets limit absorption since vitamin E needs fat. Overcooking veggies destroys vitamin E, so lightly steam or eat raw. Vitamin E is your body's shield against diabetes complications. It protects nerves, improves insulin function, and keeps blood vessels healthy. If you're struggling with neuropathy, dry skin, or frequent infections, boosting vitamin E through food or supplements could make a big difference. Number 3, vitamin C. Last but not least, let's talk about vitamin C, a nutrient most people only think about when they're fighting a cold. For diabetics, it's way more important than that. High blood sugar burns through vitamin C fast because glucose and vitamin C compete to enter cells. When sugar wins, vitamin C loses and your body struggles to absorb it. Plus, diabetes means more oxidative stress, so your body needs extra vitamin C to fight damage. And since vitamin C is water-soluble, frequent urination, a common diabetes symptom, flushes it out, making deficiency even more likely. How do you spot low vitamin C? Early signs can be subtle. Constant fatigue is a big one, as vitamin C helps cells produce energy. Easy bruising or slow healing cuts point to weak collagen, which vitamin C supports. Bleeding gums, dry skin, or frequent colds suggest your immune system's struggling. Joint pain or stiffness can worsen as vitamin C protects cartilage. In severe cases, low vitamin C can cause iron deficiency anemia, leaving you weak, dizzy, and pale. Vitamin C deficiency doesn't just make you feel off, it hits major systems. For fertility, it protects sperm in men and supports ovulation in women. Low levels can lower libido by reducing blood flow. Your nervous system suffers as vitamin C shields nerves from damage, and without it, neuropathy worsens. Kidneys rely on it to fight inflammation, and low levels raise kidney disease risk. For eyes, vitamin C protects retinal blood vessels, slowing vision loss. The biggest impact is on your heart. Vitamin C keeps arteries flexible, reduces inflammation, and prevents plaque buildup. Without it, blood vessels stiffen, blood pressure rises, and heart disease risk climbs. At a cellular level, vitamin C is a potent antioxidant, neutralizing damage from high blood sugar. It lowers insulin resistance, supports collagen for strong blood vessels and skin, and boosts immunity by powering white blood cells. It also regenerates vitamin E, keeping your antioxidant defenses strong. Getting enough vitamin C is easy with the right foods. Kakadu plums are the gold standard. 100 grams provide over 3,000% of your daily needs. Acerola cherries give about 1,600% per 100 grams. Red bell peppers are more accessible, offering 200% per 100 grams. Kiwis deliver 150% and strawberries provide 90% per 100 grams with fiber to stabilize blood sugar. For gourmet options, try a tropical ceviche with kakadu plums, citrus marinated salmon, and red bell peppers. 150 grams gives over 2,000% of your daily vitamin C. A Japanese yuzu infused tuna tartare with kiwi salsa, 180 grams delivers over 1,000%. Or enjoy a French acerola cherry sorbet with dark chocolate shavings, 120 grams for about 800% without spiking blood sugar. If you need supplements, go for liposomal vitamin C for better absorption. Live On Labs liposomal vitamin C at 1,000 milligrams per packet is a top pick. Pure encapsulations, ascorbic acid at 1,000 milligrams per capsule is another great choice. Most diabetics do well with 500 to 1,000 milligrams per day, but higher doses may help during illness. Check with your doctor. Some habits make vitamin C deficiency worse. High sugar diets block vitamin C from entering cells. Alcohol depletes it while increasing oxidative stress. Cooking veggies at high heat destroys vitamin C, so steam or eat raw. Smoking burns through it fast, and processed foods lack the fresh produce needed for stable levels. Vitamin C is a simple way to boost immunity, improve insulin function, and protect against complications like neuropathy, kidney disease, and vision loss. If you're dealing with slow healing frequent infections or fatigue low, vitamin C might be the culprit. So there you have it, the top 3 vitamins every diabetic should prioritize: B6, E, and C. These nutrients are critical for managing blood sugar, protecting your nerves, heart, kidneys, and eyes, and keeping you feeling your best. Most diabetics are low on them because of high blood sugar medications or poor absorption, but the good news is you can fix that. Start with nutrient-rich foods like chickpeas, salmon, almonds, bell peppers, and kiwis. If you need a boost, high-quality supplements can help, but always talk to your doctor before starting anything new. And watch out for habits like high-sugar diets, alcohol, or overcooking veggies that can deplete these vitamins faster. If you've been struggling with fatigue, nerve pain, unstable blood sugar, or frequent infections, these vitamins could be the missing link. Making small changes to your diet or supplement routine can have a big impact on your diabetes management and overall health. Thanks for watching. If this video helped you, please give it a thumbs up, subscribe, and hit the bell icon so you don't miss our next video. Got questions about these vitamins or your diabetes journey? Drop them in the comments below. We'd love to hear from you. And if you want more tips on managing diabetes naturally, check out our other videos linked on the screen. Stay healthy, and we'll see you in the next one.